Hello guys, welcome back to my YouTube channel. From this video, I'm going to discuss about the cervical fascia. In the cervical fascia, there are two layers as superficial fascia and the deep fascia. First, we will see about the superficial fascia. When we talk about the superficial fascia of the neck, it is characterized by platysma muscle anteriorly. It also contains cutaneous branches of the cervical plexus, anterior jugular vein, as well as external jugular vein. So you can see the platysma muscle here. This is the platysma muscle. Let's see the origin, how the platysma muscle is origin. It is origin from the fascia over the deltoid muscle and pectoralis major muscle. Then these muscle fibers pass upward superficial to the clavicle and spread out as a thin sheet in the superficial fascia. Muscle fibers that are coming from the two sides are meet in the midline. The anterior fibers, you can see they are inserted into the base of the mandible. Anterior fibers are inserted into the base of the mandible. Posterior fibers cross the mandible and insert into the mandiolus at the angle of the mouth here and into the lower lip as well here in this area. Nerve supply is given from a cervical branch of facial nerve, and the action of platysma muscle is the depression of the mandible and draws the angle of the mouth in the inferior direction. Here, as this, they depress the mandible and also draws the angle of the mandible here, angle of the mouth in the inferior direction. So that's all about the superficial fascia of the neck. Let's move on to the deep fascia of the neck. In the deep fascia of the neck, there are three main layers. Those are the intestine layer, pretracheal layer, and the prevertebral layer. Intestine layer, pretracheal layer, and the prevertebral layer. The outer layer is called the investing layer of the deep fascia because it invests the neck like a collar. This is the outermost layer, which is the investing layer. Then the middle layer is called as the pretracheal layer. It lies anterior to the trachea and it is confined to the anterior aspect of the neck. Then the deepest layer is called as the prevertebral layer. This one is the prevertebral layer because it lies anterior to the body of the cervical vertebrae. Then it spreads laterally on both sides across the floor of the posterior triangles. Here you can see these are the sternocleidomastoid muscles. Sternocleidomastoid muscles, and here sternohyoid muscle, and then omohyoid muscle, and deeply sternothyroid muscle. Here you have trapezius muscle. Then here splenius capitis muscle. Here levator scapulae muscle is present. And here scalenus anterior. This is the scalenus anterior muscle. Then this is the scalenus medius muscle. This is the esophagus. This is the trachea. This is the esophagus, trachea. Then you have the thyroid here. Here the carotid sheath and the vertebrae are present. So when we talk about the attachments of the investing layer of the deep fascia roofs the anterior and posterior triangles of the neck and split to enclose sternocleidomastoid muscle and the trapezius muscle. And also it encloses two glands, submandibular and parotid salivary glands. I'll show you in next picture. Here you can see the parotid gland and how it encloses by the intestine layer. Here is the submandibular gland. Intestine layer attached posteriorly. Here you can see the posterior attachment to the ligamentum nuchae and the spine of the 7 cervical vertebrae. Here you can see the spine of the 7 cervical vertebrae. This is the C7 and here is the spine of the C7. This is the ligamentum nuchae. So posteriorly it attached to the ligamentum nuchae and spine of the 7th cervical vertebrae. Then it passed forward on each side and split to enclose the trapezius muscle to form a single layer which roof the posterior triangle as well. Then at the posterior margin of the sternocleidomastoid muscle, the fascia splits again to enclose the same muscle. You can see the course of the intestine layer. Here is the ligamentum nuchae. Then it goes like this. It splits. First, it splits the trapezius muscle here. You can see the trapezius muscle in the either side. Then after it encloses, it goes as a single layer. Here, it goes as a single layer. Then again, at the posterior border of the sternocleidomastoid muscle, the fascia split into two and enclose the sternocleidomastoid muscle. You can see very nicely here. And then at the anterior border, again, it goes like a single layer. Here, anteriorly, the intestine layer forms the roof of the anterior triangle. When we talk about the superior attachment of the intestine layer anteriorly, in the midline, it is attached to the hyoid bone and symphysis mentae. Hyoid bone and symphysis mentae. Laterally, it is attached to the base and mylohyoid line of the mandible. Base and mylohyoid line of the mandible by two layers that enclose the submandibular gland. Here is the body of the mandible, and you can see very clearly how it encloses the submandibular gland. This is the hyoid bone. This is the intestine layer of the deep fascia. Then this is the deep layer. This is the superficial layer. Then again it attached to the body of the mandible. At the lower end of the parotid gland, also the intestine layer of the deep fascia splits into two as deep layer and the superficial layer. Then the superficial layer attach into the zygomatic arch and the deep layer attach into the tympanic plate of the external acoustic meatus. So it encloses the parotid gland as well. As you can see here, as mentioned here, the superficial layer also called as parotidomesenteric fascia, which is attached to the zygomatic arch. As you can see in this picture, the deep layer of the intestine layer, the deep layer of the intestine layer of deep cervical fascia, which is attached to the tympanic plate, contain stylomandibular ligament. You have to remember those things. It contains stylomandibular ligament. This stylomandibular ligament intervenes between parotid gland and the submandibular gland. Then when we talk about the superior attachments posteriorly, it has a linear attachment to the external occipital protuberance, superior nuchal lines, mastoid process and cartilaginous part of the external acoustic meatus. The lower attachment of the investing layer is to the suprasternal notch in the upper surface of the clavicle and the acromion, as well as the spine of the scapula. At the lower attachment, the deep fascia splits twice to enclose two spaces, suprasternal space and supraclavicular space. You can see here only the suprasternal space. Here you can see the green color line is the investing layer of the deep fascia. Here investing layer of the deep fascia is coming downwards, and here split into two and then attached to the clavicle as well, then also again reunion and continue as the clavicular fascia. Here you can see the supraclavicular space. Here above the clavicle you have the supraclavicular space. Above the sternum you have the suprasternal space. I'll show you previously the suprasternal space, and here you can see the supraclavicular space. This supraclavicular space is above the middle third of the clavicle and the clavicle. The fascia split into two layers and attached to the anterior and posterior margins of the superior surface of the clavicle and enclose the supraclavicular space in the lower part of the roof of the posterior triangle, like this. Here. This space contains terminal part of the external jugular vein. Here you can see the external jugular vein coming down here. The terminal part contains in this supraclavicular space, and supraclavicular nerves also there. Here you can see the supraclavicular nerve. Here you can see the suprasternal space of Burns. This space enclosed between the two layers of the investing fascia after it splits above the manubrium sterni. Its superficial layer is attached to the anterior border of the suprasternal notch and deep layer attached to the posterior border of the margin of the sternum. The space contains sternal head of the sternocleidomastoid muscle, jugular venous arch, interclavicular ligaments, and also lymph nodes. Let's discuss about the attachments of the pretracheal layer. Here in this picture you can see this is the pretracheal layer. Here this is the pretracheal layer. Superiorly, pretracheal fascia is attached to the hyoid bone in the midline and to the oblique line of the thyroid cartilage. This is the thyroid cartilage. So it attached to the hyoid bone, then oblique line of the thyroid cartilage, and then it descends downward in front of the trachea. This is the trachea. This layer descends downward in front of the trachea, and inferiorly it blends with the apex of the fibrous pericardium. You can see very nicely. This is fibrous pericardium and how it blends with the apex of the fibrous pericardium. Laterally, this layer covers the strap muscles and then forms the anterior wall of the carotid sheath. This is the carotid sheath on either sides. So, this pretracheal layer anteriorly forms the anterior wall of the carotid sheath, beyond which it merges with the loose fascia under the sternocleidomastoid muscle. This pretracheal fascia forms the false capsule of the thyroid gland. The ligament of Berry is a part of the fascia extending from the back of the thyroid lobe. You can see the thyroid gland. It encloses the thyroid gland and it forms the false capsule, not the true capsule. The superior attachments of the pretracheal fascia to the hyoid bone, thyroid cartilage as well as to the cricoid cartilage is responsible for the movement of the thyroid gland with deglutition, that means with swallowing. Then we will discuss about the prevertebral fascia. This layer lies between the pharynx and esophagus and in front of the vertebral muscles. Here you can see the esophagus and trachea. So this prevertebral layer is behind the pharynx and esophagus and in front of vertebral muscles. Superiorly, the prevertebral fascia is attached to the base of the cranium. Then inferiorly, it enters into the thorax through thoracic inlet and blends with the anterior longitudinal ligament on the front of the bodies of upper three thoracic vertebrae. Here is the C7 vertebrae. Then here is T1, T2, T3. So the prevertebral fascia goes downwards and it blends with the anterior longitudinal ligament on the front of the bodies of the upper three thoracic vertebrae. So here, as you can see in this picture, laterally, the prevertebral fascia forms the posterior wall of the carotid sheath and pass in front of the scalenus anterior muscle. This is the scalenus anterior muscle, so it goes in front of the scalenus anterior muscle. Then it is also anterior or it is also superficial to the scalenus medius muscle here, as well as the levator scapulae muscle, splenius capitis muscle here. It then passes over the deep muscles of the back to reach the ligamentum nuchae, or it merge with the fascia under the trapezius like this. Here you can see it finally attaching to the ligamentum nuchae. This prevertebral fascia forms the fascial floor of the posterior triangle of the neck, cervical plexus, phrenic nerve, then the brachial plexus, long thoracic nerve and dorsal scapular nerve, and also the subclavian artery and scalenus muscles are located behind this fascia. The sympathetic chain, carotid sheath, sympathetic chain you can see here, yellow color one, then the carotid sheath and subclavian vein are located in front of the prevertebral fascia. In this picture, you can see the prevertebral fascia here. You can see retropharynx, retropharyngeal space here, and pharynx here. The buccopharyngeal fascia here. The green color one is the buccopharyngeal fascia. Then the pharynx, retropharyngeal space. So, as you can see, retropharyngeal space, pharynx and the neck, the esophagus are in front of the fascia in the midline of the neck. Here there is a clinical significance as well. The retropharyngeal space is filled with loose areolar tissue which lies in front of the prevertebral fascia and behind the pharynx and esophagus. It acts as a bursa for pharynx to move. Therefore, this extends inferiorly to the mediastinum, and this space is divided in right and left parts of the midline by a fibrous septum that joins the prevertebral fascia to the buccopharyngeal fascia covering the pharynx. Therefore, each half of the space contains few of lymph nodes. So, in an acute inflammation of those lymph nodes, there can be a retropharyngeal abscess may form. Due to fascial continuity, the pus from the abscess goes down towards the superior mediastinum as well. So, it may spread laterally in the posterior triangle and give rise to a swelling, or may project in posterior wall of the pharynx as a paramedian swelling. So you have to remember that clinical significance of this retropharyngeal space and the attachment of the prevertebral fascia as well. Here you can see the scalenus anterior and scalenus medius muscles. So, in the interval between this scalenus anterior and scalenus medius muscles, the prevertebral fascia forms a tubular cervicoaxillary sheath around the brachial plexus and subclavian artery. Therefore, what happens is this sheath is carried towards the axilla. When we talk about this carotid sheath also formed due to condensation of the deep fascia of the neck. It extends from the base of the skull to the root of the neck. The lateral wall of the sheath is relatively thinner compared to the medial and to allow the expansion of the internal jugular vein. Here, the pretracheal fascia fuse with the anterior wall and the prevertebral fascia fuse with the posterior wall. Ansa cervicalis means C1, C2 and C3 is embedded in this uh, anterior wall. You can see the roots of ansa cervicalis. Ansa cervicalis means C1, C2, C3. So they are also embedded in the anterior wall of the carotid sheath. Sympathetic trunk is closely related posteriorly to this carotid sheath. The deep cervical lymph nodes are embedded in the sheath. Therefore, during block dissection of the neck, the carotid sheath is exposed to removal of the deep lymph nodes and the internal jugular vein. You can see the contents of the carotid sheath very clearly here. The carotid sheath contains the common carotid artery up to the upper border of the thyroid cartilage and the internal carotid artery above this level. There is an internal jugular vein here in the entire extent of the sheath as a lateral relation to the artery. Then the vagus nerve also present in the entire extent as a posterior relation to the artery and vein. Superior and inferior cervical cardiac branches and the pharyngeal and superior laryngeal branches of vagus originate inside the sheath. Then let's talk briefly about the sternocleidomastoid muscle, which is also a key muscle in the neck. Sternocleidomastoid muscle take origin from two bones of the shoulder girdle. You can see very clearly here and inserted into the two bones of the cranium. So it origin from the sternal and clavicular heads. Here the clavicular head and here the sternal head, which fuse to form as a single belly, and then the muscle fibers goes up and then it insert into the lateral surface of the mastoid process and the lateral half of the superior nuchal line. The action of sternocleidomastoid muscle is the contraction of the sternocleidomastoid muscle in one side causes downward movement of the head towards the shoulder of the same side and rotation of the head to the opposite side. The nerve supply to the sternocleidomastoid muscle is from the motor supply from the spinal part of the accessory nerve and the proprioceptive sensation from the muscle carried in C2 and C3 ventral rami. Here is the clinical correlation of the sternocleidomastoid muscle, which is known as torticollis or wryneck. It is the deformity in the head which is bent to the affected side while the face or chin turns to the opposite side. There are several causes for this condition as well. The congenital torticollis can be occur due to development of the fibrous tissue tumor in the muscle before birth. The sternomastoid tumor is the swelling in the muscle as a result of birth injury. So, if the sternocleidomastoid muscle is short and tight, imagine in the right side, then the head bends towards the same side and the face moves or rotate towards the opposite side. That condition is torticollis or wry neck. So that's all about the two fascia and the two muscles contained in the neck region or cervical region. Hope you gain good knowledge about the superficial fascia and the three layers of the deep fascia of the neck, as well as the platysma muscle and sternocleidomastoid muscle with the clinical correlation. So if you like this video, please subscribe into my channel for more videos and put a like and a comment in the comment section. Thank you for watching.